So there are many different receptors that use G proteins. G protein-linked second messengers are going to be an important topic for step 1. Memorizing the mechanism and general function of the different types of receptors is going to be important for the test. Now you may see 1 or 2 questions on the board. They're going to ask what type of G protein is being utilized. You may also be tested on the effect elicited by stimulating a certain receptor. For example, you may be asked, what effects on the heart would you expect when you give a muscarinic antagonist? Now, if you struggle with that question, I recommend making flashcards because this stuff is complicated. So let's take some time to go through this high-yield topic of G protein-linked second messengers. We're going to start off by talking about the sympathetic receptors, primarily the alpha and the beta receptors. And let's start off with alpha-1 receptors. The alpha-1 receptor is of the G sub Q class, and it's going to mediate the majority of functions for the sympathetic nervous system, including smooth muscle contraction on the vascular side. It's also going to increase mydriasis. It's also going to have intestinal and bladder sphincter muscle contractions. So when you think of alpha-1 receptors, the main thing to think of is vessel constriction, and this is going to cause an increased blood pressure. The alpha-2 receptors are going to be of the G sub I class. These are going to be located presynaptically. Now these act as a negative feedback mechanism to decrease sympathetic flow. I want to point out how this is a unique characteristic. Stimulating an alpha-2 sympathetic receptor actually decreases sympathetic outflow despite being a sympathetic receptor. And it's also going to decrease insulin release from the pancreas, decrease lipolysis, and stimulate platelet aggregation. The beta-1 receptor is going to be a G sub S class, a GS class, and act to increase heart rate and increase heart contractility. It's also going to increase renin release, stimulate lipolysis. So when you think of the beta-1 receptors, I want you to think sympathetic stimulation of the heart. The beta-2 receptor is going to be of the G sub S class. And it's going to have many functions, but some of the major functions are going to include vasodilation, bronchodilation, increased heart rate, and contractility. Now, do you remember the fight or flight system? Now this is going to be part of it, where beta-2 receptors are going to help increase heart rate, vasodilate, they're going to bronchodilate, so you can run away from those lions, tigers, and bears. The beta-2 receptors are also going to increase lipolysis, increase insulin release, ciliary muscle relaxation. It's going to increase aqueous humor production. Remember I said it has a whole bunch of functions. Then it's also going to decrease uterine tone. Now this last property is going to be the basis for many drugs that delay childbirth. Beta-2 agonists, such as terbutaline, can act as a tocolytic agent to decrease contractions in premature labor. And it's going to use the beta-2 receptor. So a good way to remember the difference between beta-1 and beta-2 is you have 1 heart and 2 lungs. Now, since you have 1 heart, beta-1 receptors stimulate the heart. Hopefully you have 2 lungs, so remember that beta-2 receptors lead to bronchodilation. This is just going to be the primary effect of it. So the primary effect of beta-1 is going to be acting on the heart. The primary effect in this case, it does a whole bunch of things, but you can think of it as you have 2 lungs, beta-2 receptors are going to bronchodilate. So we just covered the 4 main receptor subcategories for the sympathetic nervous system. Now I know this is a lot of memorization, but remembering these G protein-linked second messengers on test day will pay off big. So if you're going to struggle with these, I bolded some of the functions for each receptor here. Ideally you should remember everything, however, the most high-yield information is bolded. We can now move on to the parasympathetic end organ receptors. Let's start off with the M1 receptor. This is going to be a GQ class, and it's going to be found in the CNS enteric nervous system, and it's probably not going to be that important for step 1. Now, like I said, the M2 and the M3 are going to be more important for test day. The M2 receptor is of the GI class, and it's going to be having an important role as an inhibitory receptor found in the nodal tissue of the heart. While beta-1 was primarily our sympathetic heart receptor, the M2 receptor is going to be our parasympathetic heart receptor. So also notice how this acts opposite as the beta 1. The beta-1 increased heart rate and contractility, but this muscarinic subtype 2 is going to decrease heart rate and contractility. We can also introduce M3 receptors, and these are going to be of the GQ class. And now these are going to increase smooth muscle contractions such as gut peristalsis, bladder contraction, bronchoconstriction, pupillary sphincter muscle contraction, also known as meiosis, and ciliary muscle contraction and accommodation. Now, it's also going to increase exocrine gland function. Now, that means it's going to have tears, gastric acid. So activating the M3 receptor will lead to a wet picture with the tears, stomach acid, secretions. Now, we have a few more receptors to talk about. Let's start off with the dopamine receptors, or the D1 receptor. Now, the D1 receptor is going to be of the GS class, and it's going to be found primarily on the kidney. So when stimulated, the D1 receptor functions to relax the renal vascular smooth muscle, and this is going to increase renal blood flow by increasing renal vasodilation. Now, the D2 receptor, on the other hand, is of the GI subclass, and it's going to modulate neurotransmitter release in the brain. So when thinking of the D2 receptor, think of the brain. So in neurology, you'll see that dopamine plays a major function in the pathophysiology of certain diseases, such as Parkinson's disease. So when thinking about dopamine in the brain, you should always think we're going to be talking about D2 receptors. Now we can also introduce some H1 receptor. The H1 receptor is of the GQ class, and it mediates an increase in nasal and bronchial mucus production. It also does contraction of the bronchioles, making it harder to breathe, a skin pruritus, and pain. When you have seasonal allergies, you should now thank your histamine 1 receptors for causing all of that misery. Now would be a good time to slow down the discussion and talk about a common drug class, the antihistamines. Have you ever wondered what the difference between loratadine and Benadryl is? Benadryl is a first-generation H1 blocker, and it readily crosses the blood-brain barrier. In the brain, Benadryl can cause some sedative effects. Loratadine, on the other hand, is a second-generation H1 blocker, and it doesn't cause that drowsiness. Now let's have a little fun with the H2 receptor. So I'm going to ask you the following question. Can you name an example of an H2 blocking drug, and why do we even care? What is an H2 blocking drug used for? Give you a second to think about that. Alright, the prototypical H2 blocking drug is going to be cimetidine. And cimetidine is going to be an H2 blocker, and that decreases the stomach acid production. So we're going to decrease gastric acid secretions by blocking that H2 receptor. Now, this would be a good time to also talk about another class of drugs that also is going to block gastric acid secretion, and that's going to be the proton pump inhibitors. Remember, those are the drugs that end in prazole. So, to think about these two different types of drugs, I want you to close your eyes for a second. And imagine, we need to correct some vision. Are you A, going to choose glasses, or B, going to choose contact lenses? Well, both of them are going to correct vision in one way or another, so we're going to have the same target goal, and that's to correct vision. However, the two mechanisms of getting there are slightly different. On one hand, we use glasses, on the other hand, we use contacts. Same thing here. On one hand, we're going to use cimetidine, and that is going to block the H2 receptor, and that is going to decrease our gastric acid secretion. On the other hand, we have our proton pump inhibitors, and those are not going to exclusively block the H2 receptor. They're going to act via a different mechanism to decrease gastric acid secretion. So on one hand, we have these H2 blockers, lovely agents like cimetidine, and then on the other hand, we have our prazoles, our proton pump inhibitors, and those will also decrease gastric acid secretion, just not via the same route. Alright, so we have a couple more receptors to go. We have the V1 receptors, and this is going to be of the GQ class. Now, the V1 receptors increase vascular smooth muscle contraction in the body. Now, this should make sense, since vasopressin is going to stimulate these V1 receptors. Now, vasopressin kind of sounds like vasoconstriction. You're going to press those vessels together, so thus vasopressin vasoconstricts. V1 receptors primarily cause systemic vasoconstriction. Alright, and then Lastly, let's talk about the V2 receptor. The V2 receptor is of the GS class, and it's going to be found primarily on the kidney. Now, what this does is it's going to increase water permeability and reabsorption in the collecting tubules of the kidney. Remember that vasopressin, which is going to be released from the posterior pituitary, goes into circulation, and it's going to finally make its way to the kidney. An alternative name for vasopressin is ADH, or antidiuretic hormone. So like the name suggests, ADH is going to prevent diuresis by stimulating these V2 receptors, which is going to increase water reabsorption in the kidney. Now, how do we keep all of these classes of G protein receptors straight on test day? To remember all of these receptors, you can use the following mnemonic. And that's going to be kiss and kick till you're sick of super kinky sex. Now notice that the spelling isn't proper English, but to remember these, you use the letters that are in red here. So S, I, and Q are going to represent our classes. So the GS, the GI, and the GQ. So the red, you see it's all the QI and S's. So kiss and kick till you're sick of super kinky sex. Now, these correlate to the different receptors, just in the order that we talked about. So we talked about alpha 1, alpha 2, beta 1, beta 2. We then went on and talked about muscarinic, and we talked primarily about muscarinic 1, muscarinic 2, muscarinic 3. Then we moved on to the dopamine receptors, so D1, D2. Then we went on, talked about some histamine receptors, and then finally finished up with the V receptors. Okay, so kiss and kick till you're sick of super kinky sex. So here's the kiss, here's the kick, and here's the sick of super kinky sex. There we go. So this provides a simple way to remember the receptor class on test day. Now, you don't want to miss an easy point on these, so just try and commit this to memory. If you have a different way to remember it, great. But this is a very simple, good way to remember the different G protein-linked messengers. We can now talk about the signaling cascades for the various G proteins. Now we just categorized everything into either GI, GS, or GQ. So let's categorize these receptors that we just talked about a different way before we explore how each class, GI, GS, and GQ, work. Now, we have our GQ class. The GQ class are going to be the receptors H1, A1, V1, M1, and M3. So you can have 1, because look at all these 1s, M and M. So that's a good way to remember these receptors that utilize the GQ G protein. So now what is the GQ protein do? So here we see a pink receptor. When activated by some M&Ms, for example, the GQ subunit of the G protein complex is going to dissociate. So here we see it dissociating. It's going to go on to activate phospholipase C. Now this phospholipase C is going to convert PIP2 into IP3 and DAG. The IP3 is going to be in the cytoplasm, and the DAG is going to remain membrane bound. Now this IP3 stimulates the endoplasmic reticulum to release calcium, and this is going to increase intracellular calcium, and as you know, this is going to initiate smooth muscle contraction. DAG, on the other side, stimulates protein kinase C, and this is going to phosphorylate downstream messengers, so it's going to have other effects as well. So in summary, the GQ subunit activates phospholipase C, which will convert PIP2 into a few products and then activate downstream signaling. Let's talk about the GS class of G proteins. The GS class is going to include the beta 1, beta 2, D1, H2, and V2 receptors. Now, when activated, GS is going to dissociate, and it's going to go on to stimulate adenylyl cyclase to produce cyclic AMP from ATP. So notice here that GS can be thought of as G stimulatory, since it's going to stimulate this adenylyl cyclase. Now this cyclic AMP is going to go on to activate protein kinase A, which is going to start to phosphorylate downstream messengers. Now, in our third and final category, we're going to talk about the GI class of receptors. And this is going to include the M2 receptor, the A2 receptor, and the D2 receptor. So you can remember the GI classes as the MAD2s. So how do GI receptors work? Now, stimulation of the GI receptor, so let's stimulate this receptor here, is going to lead to inhibition of adenylyl cyclase. Now, this is going to lead to a drop in cyclic AMP concentration within the cell, and this is going to decrease the amount of protein kinase A activity, so you're going to decrease downstream effects. So at the beginning of our discussion on G proteins, I posed the question, what effects on the heart would you expect when you give a muscarinic antagonist? Now, remembering everything that we've just talked about, hopefully you've made flashcards on this and you can answer the question. Muscarinic M2 receptors are going to be found on the heart. Now, when stimulated, these M2 G protein receptors cause a decrease in heart rate. We have our M2 receptor. It's going to cause a decrease in the heart rate and a decrease in contractility. So blocking or antagonizing these muscarinic receptors in the heart would cause an increase in heart rate and greater contractility. So it's important to have a solid foundation on these receptor functions because you don't want to miss those easy points on test day. Let's do a quick flash quiz here. What enzyme is activated directly downstream of GQ-coupled receptors? So hopefully you remember that phospholipase C is activated by the GQ protein second messenger, which is going to go on to split PIP2 into two products, the DAG and the IP3. So you should know the differences between the GS, GI, and GQs that we just covered. So in review, GS and GIG protein second messengers are going to act in opposition to adenylyl cyclase. The GS stimulates the adenylyl cyclase, while the GI inhibits adenylyl cyclase. And then the GQ proteins are going to act via a different mechanism via the phospholipase C to elicit downstream effects.